Ladies and gentlemen, good afternoon. I am Wolfgang Ischinger, and I have the pleasure of being back here in my old home, so to speak, the Auswärtiges Amt, the Foreign Ministry, to help conduct this discussion this afternoon on global health security issues. Thank you very much for your attention. Could somebody close the doors? That would be very nice. Then we have a little more quiet. Just to get us started with a technical remark or two, I will introduce our panel in just a minute. We will have some introductory remarks and presentations by the panelists. Then, of course, time permitting, we will turn to you. As you see, there are mics in the hall. So if you wish to speak, come to the middle and speak into the microphone. And please be kind enough, be so kind as to identify yourself so that we know where you come from, on whose behalf you speak, etc., etc. We have until 4:30, so almost 90 minutes, 85 minutes now. And I think we will have a splendid time. Let me briefly just offer a couple of remarks to get us started. Of course, I am not a specialist on health, on medicine, or on other issues associated with healthcare. I am a diplomat, and I have been focusing on international, on global, and regional security with my recent assignment for the last 8 years of conducting and chairing the activities of the Munich Security Conference. But in the course of this work over the last number of years, we have step by step broadened our subject matter from classic security discussed mostly among diplomats, generals, and politicians. We have begun to embrace energy security, bringing in major energy companies. We have discussed climate security. We have, of course, discussed issues of human security, and we have come to the conclusion already a couple of years ago that issues related to health are as important in terms of international security as many of the classic issues which you would automatically associate with global politics. What keeps you up at night is a question that we tend to ask of political leaders. And often their classic responses refer to weapons of mass destruction, to nuclear issues, to terrorism, to bioterrorism, etc. Many would admit that the crisis that could be the result of an epidemic stemming from natural causes, not caused by an aggressive nation or not caused by a bunch of terrorists, has long not received the attention it deserves. But it is true, an epidemic, a pandemic, could also bring about mass destruction. In a way, it is also a potential weapon of mass destruction. The difference is there is no enemy to blame except ourselves if we don't take the necessary precautions and preventive measures. This is why we're here, to discuss the intersection between health, stability, and security. We want to discuss a threat to global security that, in the minds of many, I believe, is still underestimated. Some lessons, of course, I'm sure have been learned in the wake of the recent Ebola epidemic. I'm sure some other reasons are being learned as we speak by the challenge of the Zika epidemic, if it is an epidemic. But have we learned the right lessons? Are we taking sufficient measures to prevent such pandemics from breaking out in the future and from destabilizing entire countries or regions? So in order to discuss these and other questions, we have this really impressive panel, and I will introduce them going from my far right, your far left, to the right. Dr. Xavier Crespin, who is the Director General of the West African Health Organization. Then we have Dr. Sabani Chakrabarti, who is representing an important part of the business community. She is head of global health policy at the Merck Group, which is a large German-based but internationally active company in the pharmaceutical industry. We have then on my immediate left Professor Victor Zhao, who is a cardiologist by training, as we discussed earlier, but currently the president of the National Academy of Medicine of the United States of America. So welcome from Washington. We are not going to bother you with questions about Donald Trump this afternoon.
Happy to answer.
Even though that is, I'm sure, on the minds of many here in Berlin, what's going to happen next in that case. And then, last not least, Dr. Miklos Sochka, who is Director of Health Services Training Center at Semmelweis University, and, of course, importantly, former Minister of State for Health in Hungary. And can I say this? It's not a state secret, is it? He is... Huh? Is it okay? It's okay to say that. He is a candidate to succeed the current Director General of the WHO. The successor will be named in the course of the coming months. So, Mr. Candidate, welcome. We will start with Dr. Crespin. I would invite each one of them to speak for 5 to 10 minutes, hopefully not longer than 10 minutes, and then we'll have a discussion with hopefully as much interaction and questions and comments from you as possible. Dr. Crespin, you have the floor.
Thank you very much. I will try my best in English. I am a French speaking, but thank you very much. I want, first of all, to thank the organizer to give me the opportunity to talk here on behalf of the West African Health Organization, which is a health institution of ECOWAS in charge of health in 15 member states in the West African region. So I want to begin by saying to all of you that you know the Ebola virus disease epidemic in the West Africa, especially in Guinea, Sierra Leone, and Liberia, amplify how gaps in capacity for early detection and rapid response can contribute to a public health crisis. Between the discovery of the virus in 1976 and December 2013 outbreak, we recorded more than 1,500. But the outbreak of the epidemic in the West African region, the recent one, which began in March 2014, led to a total of more than 12,000 deaths. So it has been a very big challenge for the West African region, but for the world as a whole. This is why it is important for us, I think, this session on how we can better be prepared in response to this kind of epidemic. I just want to say that the frequency of this epidemic disease is on the right side, and this trend will continue. So there is a necessity for all of us to begin working closely and globally on this issue. As he said already, there is a big link between this disease epidemic and the other issue, like climate change, the population, which is on the right side, urbanization, war, migration, etc. But here I am there to talk first about health. So based on the lesson learned from the Ebola crisis and the other epidemic in our region, in the West African region, the head of state of the ECOWAS decided to have a regional CDC, a regional Center for Disease and Control, based on the African Union initiative. So at the West African region level, the head of state decided in May 2015 to create the West African Regional Center for Surveillance in Disease with headquarters in Abuja, Nigeria. And they asked WAHO, the West African Health Organization, to begin implementing the decision. For this, we call all the partners to support the process, and we begin working on some of the issues, among them the adoption of regulation on how to establish the procedure when it's come to operationalize the center. Again, it is based on the African Union initiative. So it is all about three aspects for us: how to strengthen prevention, how to strengthen detection, and finally, how to better response. As far as prevention, it is about seeing antimicrobial resistance, zoonotic diseases, biosafety and biosecurity, and immunization. As far as detection, it is about national laboratory system, surveillance for priority syndromes, real-time reporting disease and surveillance, reporting, workforce development, and about response, it is how we can have emergency operational center in each country and at the regional, and to build a multi-sectoral response. All of this is to build on existing organizational resources in common interest to strengthen public health surveillance in our region, the West African region. So the regional CDC is really built on national coordination unit, which means that it is important to empower countries first. It is all about building capacity within the country so that they can deliver when epidemic or other health public issue happen. Saying that, it is important to work with the country on four main components: surveillance and early warning, the workforce, laboratories and training and research, in close partnership with all the partners within the country and within the region and globally. So this is where we are currently. The step we have already done is really to have an MOU with Nigeria to establish the ECOWAS Regional CDC, to have also a board meeting for the steering committee, have also the national coordination institution within the country and have a network to be implemented, have also a laboratory network. We are currently working on assessment of laboratory system in the ECOWAS member state. and also putting in place a rapid response team, what we call at ECOWAS, the ECOWAS white helmets. We just finished the training, and we have currently more than 100 medical staff who are there, who can be deployed in the country where there is a necessity. So next step for us is to establish now One Health regional platform mechanism. Based on the lesson learned, it is important to work human health, work with animal health. So this is something all of you knows, the One Health approach. The second step is to complete the regional risk assessment and disease prioritization. Third is to reinforce the regional One Health surveillance and information sharing system. Next one is to strengthen the capacity of our rapid response team. And finally, to validate the proposal of the regional reference laboratories and establish the regional laboratory network. One final remark, I want to say that even though health is within the global agenda, as I said at the beginning, it is important for us to focus on global health security. And among the key elements for success, I think effective stakeholder engagement is key to address global health challenges. Unfortunately, despite growing acknowledgement of the ample areas that could be improved through effective collaboration, there are numerous challenges threatening the implementation of coordinating activity by stakeholders, especially at the country level. And these really include poor coordination and unwillingness to share data sometimes. So again, for us, it is important to work on improving coordination, improving effective collaboration between all of us, have a better funding mechanism to build a more effective dialogue with other sectors, including Minister of Health, the private sector, and finally, empower the country to do better. Thank you. This is all I have to say.
Thank you very much. Thank you not only for presenting a comprehensive plan, but also for staying within the 10-minute margin here. You did 9.5 minutes, so that was near perfect, a perfect track record. Dr. Chakraborty, you're next.
I'll try to stay within those limits as well. Good afternoon, ladies and gentlemen, Honorable Chair. I would really like to focus on a couple of points because I really understand the purpose of this meeting today is really to have a good discussion. So firstly, to reiterate what we have heard, and I'm sure my colleague from Institute of Medicine is going to focus on this more, I think we can expect to see more epidemics and problems, or rather I would say it's the known unknown because of climate change, urbanization, war, and the persistent income inequality both within countries and across countries. But then the question is, what do we do about this? What is known is that we can improve health systems, and that's really the area I would like to focus my talk on. I should mention a little bit about myself. I've only been in the industry 3 years. Before that, I spent a lot of years at the community level in India working on health systems, and 16 years with the World Bank working on health system strengthening. So this is my passion. I think the Ebola epidemic did teach us something, that health systems matter. They were traditionally ignored, I would argue. And even if we allocate a lot of resources, I think the challenge will always be in implementation. So let's agree that health systems are good because we help countries build resilient health systems, and it's also good for universal coverage. But I think the main question is, how do we do it? My whole life, I have heard ministries of health say that ministries of finance do not want to invest in health systems. because it's hard to track and monitor. I heard one Minister of Finance say, that's like putting money into a black hole. I just don't know what's going to come out. So I think if we want to pursue the agenda of health systems and we want ministers of finance to take it seriously, we also have to come up with better metrics. I don't know how many of you have read the book Reimagining Global Health by Paul Farmer. And one of the things he says that global health is a collection of problems. There is no one size that fits all. So there I would challenge all of us to think, how can we impact pandemic preparedness through health systems approaches? Traditionally, we've been very fragmented in our approaches. We've talked about treatment, we've talked about public health. And I think we really need to bring the two agendas together to really talk about a very systematic approach to health systems. So we need better metrics. I think we also need, and here I come to the private sector. Interestingly, the private sector is doing a lot of public-private partnerships. In the previous session on infectious diseases, my colleague from Sanofi spoke about innovations, whether it's digital health, whether it's about putting prefabricated clinics in place. But one of the challenges we face in our public-private partnerships is scalability. Once we do the innovation, we even show the results. The question is, how do we scale these up to have large impact? So I think the future fit-for-purpose partnerships, PPPs, are going to require us to work even closer together to see how innovations can be scaled up to have large-scale impact. The other point I would like to highlight is I think we've had huge success from our focus on the Millennium Development Goals through vertical approaches. Let's not forget that. We have done very successful PPPs, but the future is not going to be about vertical programs. It's going to be about horizontal programs and even perhaps diagonal programs. So I would challenge us to think, how can we implement diagonal approaches in many of the countries that are fragile and are potentially going to be hit badly by pandemics when they break out? And finally, I would say healthcare workers. We simply have to focus on healthcare workers. We've done far too little. What I do know is in Liberia, where in communities, health workers had already been trained in integrated primary care approaches, the Ebola outbreak was contained much faster than in other parts. And this is an area I don't know a lot about, but I'm going to talk about it a little in any case, which is the importance of international coordination and rapid response. So I would argue that while health systems is a key risk mitigation strategy for managing outbreaks, it does not provide 100% foolproof solution. Let's look at South Korea's health system. South Korea does not have a weak health system, and yet it had to cope with the MERS outbreak. So for me, I go back to national and international accountability structures. And here, I'm sure Ambassador Isinger can add a lot more than I can, because for me, in a way, outbreaks are similar to wars. And I'm sad to say the international community has not been successful in containing wars. We're experiencing one right now in very severe conditions. So I think we will need different accountability and governance mechanisms, and even perhaps incentives and sanctions at the country level. So let me conclude by saying I represent the private sector. We are doing a lot, right from research and development, right down to reaching the last mile. We have plenty of public-private partnerships, and I'm happy to share more experience and information if you would so like. But I think the next challenge for us is to take this to fit-for-purpose public-private partnerships, and for that we need to work with you, governments, international organizations, and civil society. Thank you very much.
Thank you very much. That was even shorter. You get first prize so far for brevity. Thank you very much. Next is Professor Chow, who has a presentation, so I think he will speak from there.
Thank you. Good. I want to thank Sabani for giving me an extra 7 minutes.
Well, that wasn't the deal.
Well, you know, what I want to talk about is getting back to the issue of security. And I'm going to make the case to you that it's health security, but more than health security. I think Elena Kickbush says social security. I think it's societal security altogether. Global security, economic impact. So this first slide shows you in the paper we published in the New England Journal of Medicine that lasts from 2002 to 2015. You only have to see this to see the frequency of outbreaks and pandemics increasingly over time. And so I think that emerging infections, re-emerging infections really continue because of the many factors we talked about, which in fact is shown in our report in Institute of Medicine, which is now called National Care Medicine. It is the convergence, the perfect storm, if you will, of multiple factors: genetic, biologic, physical, environmental factors, ecologic, social, political factors. Just think about this: climate change, war, famine, migration, urban crowding, proximity of human to zoonotic animals to zoonotic disease. So all this is the perfect setting for more and more emerging infections, if not re-emerging infections. Now, this is the key finding in our report, which I'll talk about, which is that most people think about security, as you heard from Ambassador Ischinger, as military, as bioterrorism, as terrorism, cybersecurity, homeland security. But in the last 100 years, with Spanish flu and HIV, we have deaths of nearly 100 million people, more than many wars that have experienced. So the human lives are really important as a first factor. I'm a doctor, and I certainly believe that every human life counts. But also, as we did the analysis in this commission I'm going to tell you about, led by Peter Sands, we used Harvard Investigate to look at what is the economic impact. What surprised me, of course, in the last 10 years is $60 billion of economic loss a year, which translates into, if one would talk about this century, $6 trillion. And if you include Larry Summers' estimate in terms of cost of life lost, we're talking about $400 billion a year. So it's actually, any one of these things can actually affect global GDP. So the global impact of this, of course, leads to fear, contagion, particularly now with the weight of social media, mistrust of the government, unrest, political unrest. Hence, therefore, it's more than health security, it's also global and economic insecurity. So pandemics pose a threat to global security. Why did I talk about that? It's actually what Shambhani just said. Minister of Health says it's a black hole. What I hope to do is to get the message that we need to invest in health in order to have a secure world. And that's the message that I'm going to talk about today. Now, just take Ebola. 28,000 cases, 11,000 deaths, tremendous economic impact in West Africa, and that actually has triggered this whole wake-up call, if you will, that many of us are focusing on. This slide shows you that there's failures at all levels, and I won't go through every one of this. You already heard from my previous two speakers about international failure in terms of lack of coordination between public-private organizations, civil societies, lack of ability to mobilize resource, and of course, delay due to delay to recognize the magnitude outbreak. At the country level, clearly, as you've heard, limited trained workforce, limited infrastructure, limited supplies, and the sharing of information. And importantly, one must not forget the community level, where there's tremendous cultural differences between countries, and the trust and the mistrust of government, and therefore the ability to actually respond rapidly. So about over a year ago, the National Academy of Medicine commissioned an international commission of 17 commissioners from every continent and from many different countries. We were supported by the Gates Foundation, Wellcome Trust, Moore Foundation, and 7 other foundations, with the idea of creating an independent report, and I'll mention briefly of the other reports. So the independence is what the focus is, and the question we ask is, what should the world create a framework for global health risk framework for the future? As you can see, the report, which was published in January, has the title, The Neglected Dimension of Global Security. So what do we say? Well, as you heard already from our previous speakers, we need a more effective and global regional capabilities. First, who should lead this? WHO got lots of criticism for its slow response or the lack of coordination. So if you do a little soul searching, we still believe that WHO should be the organization, but it needs to have resources. It needs to have finances to be able to create an emergency response. We suggested there should be a Center for Health Emergency Preparedness, WHO, and also importantly to coordinate across the UN system with many different humanitarian agencies, with civil societies, as you heard also from private sectors. We talk about the need for a resilient, strengthened health system in every country, national public health capabilities, infrastructure, and we talk about an accelerated program of R&D. So on the first one, the creation of an emergency center, of course, what you want is the ability to move quickly, to be able to track these issues, to be able to monitor and provide expert support, and to have a daily priority watch list of outbreaks with potential to become an emergency of international concern. And importantly, as you heard from many discussions, there should be a contingency fund for WHO, and the World Bank should also establish a pandemic emergency finance facility so that money can be mobilized when it's needed, so workers can be paid, and therefore you have much better response. And of course, World Bank and IMF should provide budgetary support. I think the number two is really important, as Shivani talked about, which is recognizing that each government's basic responsibility is to protect citizens. And my colleague from WAHO also talked about this. Clearly, you need to have strengthening health systems and public health, but also you need to be able to measure core capacities and external assessment. Because what happened, as you know, in 2005, the 198 member states agreed on international health regulation. It was a self-assessment, with only 20% country compliant. So I think we need to move on now to agree on the precise definition and benchmarking of those capabilities. And of course, we may talk about the Global Health Security Agency, as well as, of course, using the One Health measurements as well. External independent assessment, using possibly the joint external evaluation tool by WHO. Bilateral and multilateral donors declare funding contingent on the participation of assessment. And of course, Peter Senziner wrote a paper in Lancet and others to say IMF should assess the economic stability or performance of each country to include pandemic preparedness, which it does not. And finally, hold governments accountable with protocols for avoiding delay in reporting and travel restrictions. So strengthening health systems is public health, it's care delivery, it's capacity, it's public-private partnership, and it's engaging the community. And finally, the last topic is R&D, vaccines, medical products. As you know, it's generally felt that vaccine is a market failure by companies, and of course, mobilizing this kind of response is difficult. So the idea would be to have high standards to use data that's interpretable. At the Institute of Medicine, we are now looking at a study to say what is the right protocol for emergencies for vaccine trials, to have information exchange, to streamline protocols before the outbreak so that it can expedite product approval, and to harmonize regulatory framework so that one can approve in one country, can quickly move to the other. So this is our key slide, which is the world needs to invest. And we were bold enough to say the world should invest $4.5 billion a year. Now, you may think it's a big number. Remember, the loss is $60 billion. But if you think about the money that's invested in military security, homeland security, bioterrorism, cybersecurity, this is a small fraction. And we've broken down to three categories. At the bottom is R&D. The second is what I talked about in terms of contingency fund and the pandemic facility, financial facility by WHO. The third is actually the most expensive one, which is assessed by WHO to say, this is how much money you need to strengthen health systems. We believe that has to be a commitment of each country, with the support, of course, of other countries, for low, middle-income countries, to actually strengthen to protect the citizen. Now, this slide shows you we're not the only report. In fact, I highlighted 4 such reports, of which we won. And there's tremendous convergence and agreement on the report. And, of course, also the UN Secretary General now have a task force to look further into the recommendations. So where are we today? My last slide. Well, first of all, the good news is there is some reform going on in WHO. In May 2016, announced the creation of a new health emergency program with an executive director and an independent oversight advisory committee, very much similar to the proposal we and others made. Second, at the G7 meeting in Japan, it clearly made the statement that there needs to be WHO reform, there has to be funding, coordination, and preparedness. So the WHO contingent fund is just beginning. Japan certainly and other few countries has committed to it. And through the leadership of the World Bank, through Jim Kim, the pandemic emergency facility is now being developed. It's got some money in it, but it's going to use reinsurance and capital market as a way to solve problems rather than direct contributions from companies. Last point. As the Davos meeting in January 2016, there's a coming together of a group of CEOs of companies that make vaccine, of Gates and Wellcome Trust and Gates Foundation, of the World Economic Forum, of academia, of NIH, BARDA, and many others. And now there's, in fact, a new entity called the Coalition for Epidemic Preparedness and Innovation. It's a public-private partnership that is now official. The secretary is in Norway with an interim CEO, and I serve on the board of directors. There's a scientific advisory committee and a joint coordinated group which looks at how to de-risk and come together to prepare for vaccine development for the future. So we are moving, although somewhat slowly, and I think the G20, which is going to be held in 2017 here in Germany, we need to make sure we send a strong message to G20 to support this and to mobilize the political will, because at the end of the day, it is the political will that will make this happen. Thank you.
Thank you very much. Excellent. And now, Minister Socska from Hungary.
Thank you very much for the invitation, Mr. Chairman, and dear colleagues. I did not bring a presentation in its traditional sense. I brought you 3 pictures, and I will contact my message with it. And when you are reading the recent Zika and Ebola reports on the preparedness and the responses, those are reassuring. But there was not a test yet. And for decades we were preparing for the novel and emerging diseases, and we were taken by them as a boiled frog from the Charles Handy explanation. So we were not able to react in the good sense. And and let me show you one graph. This graph is about the interconnectedness of production of pharmaceuticals. This country in the middle, or this producer, sells products or substances to other producers who package it or reproduce it and sell it in so many countries. And what if this dot does not produce profit anymore? So the marginal cost production was pushing the limits of production. And what if this factory is poisoned? So I think when we are talking about health security, it is not just the infectious diseases anymore. but in this modern world, it is much more than that. It is the resilience of the pharmaceutical production and the pharmaceutical supply globally. And that's another issue. And you know, it was. You remember that there was a shortage in the platinum content oncological medicines in recent years. It was not forecasted, but many people suffered from it. So we have to prepare this kind of emergencies as well. In the prescription of the section, there's a prescription saying that health security became a priority. But I'm sure that those of you who traveled from a far distance, you can experience that the security measures around terrorism make you take off your clothes many times during crossing borders, and there are a lot of activities around security. But when I think about Austria, there the childhood immunization rate is below 50%, and I do not see vaccination posts set up in the countryside, and I do not see an agile preparedness for a potential outbreak of some childhood infectious diseases. So what I think is that in our mind and in the political decision-making priorities, health security is still not there yet. And we have heard from the previous presenters that in this interconnected world, the outbreak of infectious diseases can cause a rundown in our global systems. I'm sure that the national security agencies have calculated the cost of 1 day of war, but is there a real calculation on the national security or international security level, the calculation of, we have just heard a calculation of the costs of the outbreak, but is there a calculation, what is the rate of investment through which we can avoid this kind of risk or we can manage this risk? And what I think, I really have to acknowledge the public-private partnerships and the donors that were sacrificing their profit and their income and their tax money to handle these risks. But I think, being in Germany, we have to utilize the Bismarckian risk-sharing logic on an institutional way. So I think, and it won't happen overnight. But we should start the work and start a dialogue between government, non-governmental actors, business communities, civil agencies, foundations. So we should institutionalize it, because otherwise we won't be able to share the risk. Because this is not, setting up primary care in Liberia and other countries. This is just not a one-time emergency intervention effort. There should be an institution, and in this world we are interconnected, either by marketing or by travel. And this is always a question. There are these voluntary assessment. Can we rely on voluntary assessment? Yes, if we are honest. But politics does not work like that. And there is a very paradox risk in crisis communication. I remember the killing cucumbers. We are in Germany. You remember that somebody said in Germany that this E. coli, I think 53 people died in Germany. This E. coli infection is coming from Spanish salad. But this was some sprouts from Lower Saxony. And this is a very paradox stuff in crisis communication, whether we say the truth, whether we are trustworthy, whether we are considerate enough. Just remember the Zika communication. We were much more prepared in Zika, but it sort of threatened the Olympic Games. So the crisis communication is a very tricky thing. We have to raise the trust towards these health security agencies, the international health agencies, and we have to be very behaviorally tailored when we are communicating this kind of risks. Then let's talk about ownership a little, because and we cannot impose solution on countries from the outside, and we desperately have to seek for local ownership. And we have to support the development of local capacities, and we have to avoid the political risks of crisis communication, and we have to enable those who are locally owning and willing to solve the problem. There are people like that in Hungary, morbus hungaricus, the tuberculosis was a huge issue, and we have solved it, and we are world leaders in prevention on non-communicable diseases. And in the first year of introducing HPV vaccination, 80% of people were asking for it. So we have the experience that we can do it. Others can do it as well. So then the scapegoating. And I'm 100% sure that there were a lot of mistakes done in communication and preparedness. But we do not have to forget that there are industrial interests or other vested interests or conspiracy theorists who are interested in preventing us making decisions for health, not to talk about the infiltration of tobacco industry in the political decision making. So we also have to remember that that is a proactive thing that is causing burden of disease and destabilizing national economies with the burden of disease. I'm a little bit afraid that I'm running out of time. We really need impartial leaders. I was very happy to see the report that in the US there was a need for independent report. And I think when we are thinking about or talking about WHO, we need independent agencies. There's so many things in the world are interest-driven, so we have to make sure that there are independent voices in this territory. Because, and again, national health security. This is not just infections, but the non-communicable diseases, they are spreading by marketing. Is it a vector? Yeah, it's sort of a behavioral vector. So we have to think about those issues in a global sense. And let me just mention two more things. This personalized medicine and genomic data collection and genomic big data is really offering hope for personalized medicine. But I think the genomically targeted cure works in the same logic as genomically targeted poisoning. So I'm really worried that when we are not there to assess risks that are coming from the new technologies, data collection, and we do not talk about the risks in measuring digital phenotype or collecting big data genomic databases. So we also have to start to talk about this kind of new risks, because that goes to the core of humanity. Because if our genomic identity is a marketing product, or you can be targeted by your genomic identity, that's an issue. It is good, just like nuclear plants. Oh, sorry, they were generating a lot of energy. They are generating other problems, but they are generating atomic bombs as well. So I think that's the same logic we have to follow that. And the last thing is that I've just seen an initiative. Some guys started a website called Planet Voting, and they want to vote on issues on a planetary level. And what about planet health? So I think we are globalized enough to start to talk about health issues globally. Thank you very much for your attention.
Thank you very much. I wonder whether Dr. Chakraborty or one of the other panelists would like to maybe comment on some of the points that were just mentioned. Would you like to have a word?
Sure. Actually, I did want to comment on your presentation, because it's interesting when they talk about the IMF doing some sort of preparedness assessment, but as you are well aware, and this is a bit of a controversial statement, but I'll just say it in any case, is that the IMF also faces a lot of problems when they are ready to declare an economic emergency in a country, because there's a moral hazard situation. So I think you have to be careful, but I think it's an excellent idea if it would go ahead. Thank you.
Yeah, Victor.
No, we're not talking about emergency as economic emergency. We talk about baseline assessment of a country's economic status. It's surprising to me that this is not part of the measurement. When you look at the numbers we show, you would want to say, is this country prepared? And what happens if it's not? Right? So it's not the emergency assessment, it's the baseline assessment of performance.
I think we have reached a point where we can take comments and questions from the audience. So I'll recognize the gentleman in the third row. Please take the microphone in the middle and be kind enough to identify yourself. And also, please, if you could, let us know whether you address your comment or your question to the entire panel or to one or several of the members.
Okay, thank you very much, Mr. Chairman. Actually, I have a few comments before question, because I had the privilege of attending in February this year a meeting organized by the Science Council of Japan when the G7 meeting was to take place in Japan. And, well, I represented my academy. I'm the president of African Academy of Science. And it was, they called it G Academy meetings, where Royal Society, National Academy for US, German Academy here, and so on, G7 academies. Of course, some of us are not G7, but we were there. So the important thing is that the Science Council of Japan wanted to place before the G7 meeting some global scientific issues. And one of these issues presented before them, which we deliberated upon and made recommendations, was having to do with disasters all over the world. I mean, not just medical, tsunami, earthquakes, and so on and so forth, And they wanted G7 to take a position. And briefly, what we recommended as academics was that the G7 should take frontline position on these matters. Of course, the medical will be a very big component of this. And the way it will work, unfortunately, I don't know what G7 decided. And I mean, but I think that the National Academy of Medicine in US mentioned it. Maybe you know what they decided, but I don't know. But the way it was supposed to work is the following: that the G7 is there in their countries, the national academies of those countries were there, and they will champion whatever the G7 people decided, and then just as we have ECOWAS and another sub-regional something, we should be able to influence national academies who will influence their countries, the countries where they are located. And of course, the WHO, UN, and so on, they are in another category. So the feeling is that if we are organized internationally, whether a country is weak or strong, if there is any emergency, there will be rapid response. Once the G7 decide, I know when they are interested in something, they put a lot of money, they put a lot of organization and so on. So.
Thank you very much. Maybe we'll take 2 or 3 questions, but please, I'm addressing myself to my panelists. If you wish to respond right away, you want to have a word, please? Yeah.
So the G7 did take a position. I abbreviated the presentation, the need to have WHO reform and the need to have funding, particularly the Pandemic Facility Fund was actually a launch at the G7 meeting by World Bank, and the need for coordination, but it was more broader statements like that.
Yes, sure.
I think it's not either or. I think you need strong country health systems, but when there is an outbreak, I think the important thing is countries simply may not be able to mount a response very quickly on their own. And that's why you need a global architecture that supports that so that you can move in quickly. So you need a little bit of, that's my feeling, you need both.
Yeah, please.
Sorry, just a quick comment. And what if a country that is emerging from a conflict without public administration or visible public administration system, what can we do with them? Whether the peacekeeping or the reconstruction is containing public health reconstruction as well. So that's an issue. I did not see that happening in a large scale.
Hello, hi, I'm Beher. I'm actually a Master's of Global Health student at University of Geneva. I just want to ask a question about the planetary health. Actually, I don't want the whole panel to answer the question, but if someone would say it, it's fine. It's about what is the applicability of planetary health on the national levels? Like if we took, for example, WHS 194 member states. So how would we have a reflection of the planetary health concepts on the national level, knowing that we have a lot of stuff on the national level that we care a lot about, like health system strengthening and other areas. So how would we have concrete implementation aspects on planetary health on the national level? Thank you.
It's not an easy thing, and there's a question whether WHO should be a global leader in health, or follow the will of the member states. And I think the member states are sovereign countries, but I think we need a global health leadership as well. So it can be formulated and shaped globally, and I think this is just like preparedness. Mm-hmm. If it is an agile, proactive process giving feedback and giving independent opinion on the state of preparedness, that's another issue than if we are just waiting for independent assessment. With coordination, you can do a lot of things without harming sovereignty. So leadership in global health is an issue.
I quite agree, and I just want to make sure we say just a word about global health security agenda, because this is voluntary, but with 50 to 60 countries all participating, but given the kind of resources to actually build capacity, but subject itself to external evaluation, I think that's the direction to go. It's hard to imagine that you can go into sovereign state and to say, we're going to take over. On the other hand, I think that one has to really move in that direction where there's unison to move in the right way. And I think that certainly, in my opinion, the GHSA is one step towards this. And I think the G20 has already said they put 30 more countries supported to enter the GHSA. And the more, I think, then most of the countries will be up to the quality that you would like to see.
Well, if I may, I'd just like to nail this point down even a little further. I mean, I'm sure the audience is aware of the fact that this phenomenon of countries or groups of countries that find that their collective or individual ability to handle certain problems is underdeveloped, is not up to the task. It is not something limited to countries in Africa. It happened right here in Europe. Those of you who are Europeans will know what the Schengen system is. And we built the Schengen system where we abandoned the internal frontiers. And the idea was that those with outer boundaries would take care of that. But we didn't think enough at the time of the creation of the system of what would happen if one or several of those member countries, for whatever reasons, would not be able to carry out that particular job. And that, of course, created enormous tension and enormous problems within the European Union and the member countries. Now, once the problem had become apparent, now, after some debate within the European Union, we now have on the table, in fact, the decision has been taken in principle, that we will have an effective Europe-wide force called Frontex that will step in if and when there is a gap in capability. And I think this is an example from a totally different area of collective engagement and collective responsibility that is really an important model. The problem, it seems to me, is that in most cases, the international community, whether it's on the global UN level or on the regional level, tends to act in a kind of a form that is too little too late, quite often. In other words, we need to encourage the decision makers to be more ambitious and to act not only once the catastrophe has become a headline material for all the media, but preventive, earlier action is needed. So more questions and comments. Yes, can I just see hands so that I know how many wish to speak? Sir, you were the next.
Thank you very much. My name is Rashid Khaldoun. I'm a medical doctor doing a master in public health at MCI University in Austria. First, I have some short comment. I will be not too long, and I will end by a question. I want to say really thank you very much because you deliver, all of you, deliver a positive message. This positive message, we are talking about global security, and it was discussed from different point of view. It's about multi-sector and multi-collaboration. We have a private sector, organization, academic, public health, diplomatic. So thank you very much because this is, you are showing an example for all people who are here, and because this is a cornerstone or a stone corner for addressing global security. Second comment, I think that talking about global security, health, it's also talking about a global governance. And global governance, it's about what it was pointing out, innovative financing. Now, NGOs or states are not able to, so that's why we need private, we need new ideas to bring the requested amount of money that people can work and do research, can give a good... and also it's about sharing information and about, once again, this collaboration between the... My question, it was, I think when we address global health security, we need also to not forget about mobility, which is very important. Migration, it's not just people who are moving for work or for certain like conflicts, but also it could be that they moved and they need to come back. So it's not just about screening when we are scared by the media that maybe migrants are bringing tuberculosis and this, but I think mobility and security need to... So my question, is there any initiative to present a kind of policy regarding global health security and mobility or migration? Thank you very much.
All right. Any takers for that particular question? Well, then we'll collect two more and then go back to the panel. Frau Kickbusch, I think you were next. And then, okay.
Thank you. I'm Ilona Kickbusch. I'm a member of the Secretary General's Task Force on Global Health Crises, which was set up to follow the recommendations of the high-level panel on health emergencies. What we have been tasked is to look particularly at the cooperation within the United Nations system. And I believe there are a lot of governance challenges, as you said, that we will still have to address because that system does work in silos. One of the reasons it works in silos is because it is financed in silos. And there is a great fear that if we come together, my organization would lose some of that financing. So I do think the issue of financing poses itself in quite a new way. And in a global risk society, we are really challenged to consider new forms of financing of global public goods. And global health security surely is one of them. Two things that I think relate to that. One is that I don't think we have spread the notion of which parts of the private sector are actually part of this security discussion. And we have, if we have that broader notion of security, we have the airline sector, the banking sector, practically, who will be affected, as Victor has described, within a society, and how prepared are each of these sectors? How prepared is our public transport if there were to be an outbreak? And that also shows that in terms of the actors we bring together, as the Sustainable Development Goals say, bringing cities together in terms of preparedness is going to be ever more important. And I believe having that political focus will be absolutely critical. My third point relates also to a discussion we had at lunch today here at the summit. Miklos related, we have to think health security broader than just outbreaks. We can have a discussion just how broad, but what was mentioned in the lunch is obviously particularly the links to humanitarian crises, to fragile states, and to the fact that there is not even health security anymore in a hospital, that we are faced with bombings, we are faced with a lack of commitment to values that we have developed in the UN system, and what it means to our common security if we cannot agree anymore on a basic set of human rights and humanitarian values, to me, could be one of the greatest challenges we face in health security and security overall. Thank you.
Thank you very much. Now the next one is the gentleman here in the first row, and then you'll be the last one, and then we'll go back.
Yeah, my name is Janko Brandt. I'm co-founder of One World Doctors, a platform where medical doctors can meet their peer in need, for example, if it happens to a catastrophe or a difficult diagnosis. And actually, I have a quick question to Xavier Crespin. I'm interested in that laboratory network you mentioned, and I would like to hear your expectations and also bottlenecks in constructing this network, and also in the context of One World Health, and how that illustrates your lessons learned from Ebola. Could you think of a world laboratory or something like that?
Okay, and the last question from the lady.
I'm Valentina Iammi from the London School of Economics. My question, I suppose, is for the panel, the entire panel. And I'm joining the call of the lady before me that flagged the issue of the role of multiple sectors, the impact in multiple sectors. So this intervention and response that need to be horizontal, and the need to use very innovative way of financing, but also the diagonal perspective that Sabani mentioned, which is incredibly, enormously important, and that is often missed from the picture, so the long-term impact. So I would like to know your vision on new possible form of financing in the short term with a diagonal vision, with a long-term vision, and a scalability and sustainability of the action. Thanks.
I'm looking around the room. Are there other questions? Well, we'll take, is that the only one? Then I think we'll go back to the panel now and take then a last round of questions. Yeah.
So I think Ilona made a very important point, and this just struck me. I think we have always lived in a complex world, but it's getting more and more complex. And I think the challenge is going to be for us that we have to be multi-sectoral, we have to be whole of society, whole of government. But we don't have a lot of evidence. I mean, in the whole time that I was at the World Bank, we tried to do cross-ministerial projects, and they always failed. This is why as I would argue, we haven't made a lot of progress in gender issues as well. So, I mean, this is what keeps me up at night, because I'm working on another project called Healthy Women, Healthy Economies, which also says you need to empower women, but in order to do that, we need to be multi-sectoral. So I would challenge all of us, and then let's look at good evidence and share that. On financing, it's an incredibly complicated topic, I think. But I worried when the Addis conference basically said that we're not going to have a lot of international financing, development assistance. It has to be domestic and private. That worried me a little bit. I thought the discussion would be more on how can we develop instruments that you can mobilize multiple elements of financing to create the right incentives. So I know the World Bank is working on performance-based financing for health systems. You have the pandemic preparedness. I think we need more instruments that mobilize public and private in innovative ways and not fragment it and say, oh, we're not going to have a lot of international financing, so it has to be domestic or private. Thank you.
So I'm going to try to respond to financing, health security, and migrant. On the financing, I agree with Chabani. It's very complex. As you know, that number of mechanisms, I think that most of the countries are a little, fatigued from actually being asked all the time. In our country, I know that they're not willing to put any money down for an emergency, but rather that you have to go to Congress when you need it, we'll find the money. So it's a real tricky issue. That's why I think that new financing tools are important. The pandemic emergency facility, finance facility uses now the capital markets and using reinsurance. So rather than asking donor countries to give the money, now you just put it into insurance or some kind of contingency commitment of some sort. So that I think is a good idea. There's no easy way when it comes to strengthening health system of each country. We did the analysis, World Bank has, and looked very carefully. Countries have to commit resources for the long-term good. If they're not going to do it, it won't happen, despite how much development money you have coming from the outside. But I quite agree that we need new tools. Health security. We talk so much about infectious outbreak, which is acute and abrupt. But as you know, NCD, to me, is a form of health security because eventually it can disrupt economies so much that it will create instability. But also bioterrorism, and now, of course, science and technology. Think about gene editing. Gene editing now can do gene drive into plants, insects, animals in a rapid fashion. That can create tremendous instability in our ecosystem. If you use it properly or improperly, or actually use it with bad intent, all those things are really creating health security and not just Ebola and others. Oh, and migrant. You're so right. I think there's a lot of discussion at this meeting about health and migrant workers and people who are refugees as well.
Thanks. And there was a question addressed to Xavier.
Yeah, before the question, I think there is this specific question. There is another question on how we can implement at the country level some of the decision made maybe at the international level. Here there is it is a big question. I think, as someone said already, there is a need to have a really global health agenda and with clear messages when it's come to the country. Sometimes there is really a confusion when it's come to the country level to implement some of these big decisions made. And this is why I strongly believe that there is a need to have a very strong WHO within the country to deliver the real message. So there is no confusion in what we are doing. The message is not clear sometimes. So it brings back the question of coordination. When we come, coordination, effective collaboration, because we need this to have really a clear model when it's come to response, to be better prepared for this epidemic. So the question about laboratory is one of the components of the regional center for disease control for ECOWAS, is one of our main components. We see from the Ebola crisis, one of the weaknesses in our country is testing, screening, and have early warning on this. So we decide to implement the laboratory network. We are now engaged in doing an assessment at the regional level to see what we have within the country in terms of laboratory, the existing laboratory, what also we have in terms of reference laboratory within the region, so that when one country needs some assistance, we know where to go to have this assistance. And the third one is we are currently working on the status of this network. So this is what I can say from now. If you want more information, we can discuss maybe later on. Coming back to the issue of health and migration, I am happy that this question was raised, because it is very important now. For us in the West African region, we are seeing this migration issue growing and growing. So we began working on policy related to health and migration, and how sometimes within migrants we have health professionals, how they can just leave from one country to go to another country. So we are working how best we can integrate the issue of migration in health policy, how we can also improve on harmonization of the curricula when it comes to training, so that we can meet this goal of free movement. There are also some other questions about access to health services, the living condition of migrants, all this issue we are just discussing, and I'm happy that you raised this one. This is a very important issue that we really need to work on for the next meetings, I think. Thank you.
Thank you very much.
So just number one is the word laboratory. You know, we have IT and telecommunications ecosystems to shoot at submarines and throw angry birds at pigs. So we have these computer toys on your phones, and that's a worldwide ecosystem for that. I'm 100% sure that the same ecosystem could be used for health purposes as well. So word laboratory is not a dream in the 21st century, number one. And this can take diagnostics to places where it never existed before. So we should invest in something more reasonable than angry birds or something. Number two, migration issue. Not only the border system was not prepared, but health is a national issue in the EU. And during our presidency, we were arguing for a minimum set of joint health policy issues. Greece and Italy were sending us warning since 2011, I think, or 12 at least. And there was no rapid response to their cry. So I think there has to be a mechanism for that. The local national health services did well. The WHO report proves that. But there was no joint effort from the beginning. This takes us unprepared. And that was it. Sorry.
Thank you. We have time for 2 additional, hopefully brief questions and a brief comment from the panel. Sir, and wasn't there somebody in the back? Yes, the lady in the back. You're last. Okay.
Okay, thank you for the wonderful panel. My name is Amir Takian from Tehran University, Iran. I have 2 questions. The first one is, we live in a world that the public health challenges and the issues of security, health security, has changed dramatically. Yet the structure, the governance structure for the health system is in a way that addresses something, and the stakeholders who are not necessarily the main players in this current situation. And I was wondering whether, when we are addressing this kind of global health security challenges, and the most important one is, as Ilona mentioned, engagement with the players like NGOs, CSOs, international philanthropies who are in the market. And given the situation that we have, for instance, I come from the region that terrorism, active bioterrorism, and number of refugees is high and is increasing. So how we can change the governance of the world in a way that we can address those challenges? That's my first question. And my second one related to this is the financial system that we have in place. In the context of WHO, almost 80% of the budget is coming from some donors. And those budgets, you will have a difficult job, gentlemen, to do this, because the budget is earmarked for some particular activities. So how, related to the first question, how do you think we can somehow revise this policy making in a way that earmarked budgets can be spent on the things which is related to the global security, not necessarily the agenda of some particular donors? Thank you very much.
Thank you. Interesting question. And now the lady in the background.
I am Lourdes de la Pesa from Mexico. I work for Management Sciences for Health based in the US. And it's kind of question, also reflection. I was just in Liberia 3 months ago, and there is no electricity, no drinking water, no roads. So how information can, it is not strange that this kind of epidemics, outbreaks happen there. And it is so much poverty. And we are talking a lot about health system strengthening, but we know in this kind of countries, maybe 90% of the investment in health is done by donors, external donors. And still the poverty in these countries with the richness in our countries is so, the difference every day is worse and worse. And I don't know if it is a question or reflection, because if these countries are still that poor, how they can possibly really fight against those outbreaks if they cannot deal with the simple day-to-day maternal health care? And they are going, I am just imagining when I was there, I have to wash my hands and everything with water from the pot because there is no water in the pipes. So how they can do it? But if we are going to do this from outside, are we able to sustain the health systems from outside? So I'm thinking about the Sustainable Development Goals, thinking that we need to think how these countries can progress. How are we doing in order to help them have their own work, their own richness? Otherwise, it never will work. I was last 2 weeks, I was with people working in one of these developing countries with money from Global Fund to work against tuberculosis. But these people living in this little house, everybody just in one 3 by 3 meters house, 10 people living there coughing. And then this guy was saying that it is an estimation that 1/3 of the population of the world already have infected. Probably they are not transmitting yet, but probably the next time you are watching a movie in a theater, the people who is next to you will be coughing. And you don't know there's these bacteria that are resistant to our medicines. So what are your reflections about what are we going to do about poverty? Because if we don't work against poverty, we are not going to be secure anywhere in the world.
Thank you. Thank you. You're making an important point. I'm going back to my panel. Who would like to offer a response? Yeah.
So I would like to focus on the poverty question. You're absolutely right, which is why when I made my comments, I said we need to make a long-term international commitment to these countries. But let's not forget that there has been a lot of money invested in Sierra Leone as well, or in Liberia. The question I would ask is, have we also asked the question, how was the money invested? There have been cases of corruption. And you know, I'm in the private sector, and the way I look at it is, don't just work with the government when you invest money. Work with the private sector, work with civil society, and start creating structures that creates a dynamism between private sector, civil society, and the government. Because if we only depend on governments, that's too much burden on them. If we only depend on private sector, that's too much burden. But if we can create multi-stakeholder approaches and invest in those, in an architecture that supports multi-stakeholder action, I think we can, in the long haul, begin to address this, because governments are also fragile and they change. But, you know, sometimes the private sector and civil society is there for the long haul. So I would suggest just adopt a multi-pronged approach. Thank you.
The last two people asked questions, to me, just put their hand right on the pulse of the great challenge we face, as you know, in governance, in poverty, and all those issues. And, you know, it can be pretty depressed when you think about this. That being said, I do agree that public-private partnership is important, because the private side, they have people on the ground, and you know, they have their own workers, they have their own supply chain and systems, and they care about their business. So actually, a mechanism of bringing private sector is good. I think CEPI is a very good example, at least in the right direction for a vaccine. If you have a chance to look it up, if you don't know about the CEPI, which is really trying to bring together a public-private partnership to say, let's share technology platform, let's joint identification of joint targets, and let's raise money together with government and private sector in order to move vaccine forward. It's one form of public-private partnership. And finally, the issue of resources in each country. It is indeed a challenge between where the money goes to, where the corruption is, and how can we actually effectively make sure that those dollars reach the right purposes. It's a big challenge.
Yes, a brief one.
Yeah, very briefly. But I may disagree with some of you, but I think it is important. When I finished my speech, I said it is very important to empower countries. When I say country, it is not only government, but all the components of the society within the country. But we cannot just say because government are corrupted or something like we put aside the government. We cannot develop country without government also. So let's help the countries, let's help the government for a better governance so that we can build better system within the country. Thank you.
Thank you.
So just two quick answers, because it was sort of others to me. First of all, our Mexican colleague. You know, in Hungary, in the deepest times of austerity, when Hungary was sort of balancing on the edge of fiscal sovereignty, this is really, really tough. What we did, we introduced public health product tax. We were taxing chips and sugar content beverages, and we generated money from it to slow down the medical and nursing migration. So I think even countries can set up innovative initiatives towards universal health coverage. And if it is just for tuberculosis or something, then we have to start with that. So we have to find innovative issues. And then the colleague asked about the big guys who are eating traditional institutions for breakfast. Unfortunately, they have goodwill because they're donating their wealth for global health purposes, which is a good sign. But this this happened in an institutional environment where there was an adaptational vacuum. And they were coming in that, hey, do something. There's a room to do something, and we donate money for you to do something. So I think, and you know, I really do not want to campaign here, but what I say is that better health, stronger WHO. So what I think, if there is agile performance, then the money could come. So I think we should rebuild the institutional authenticity, and we have to balance that issue, that guys who are eating us for breakfast, telling us what to do. I think we have to balance that issue.
Thank you. I thought that was a pretty good attempt at campaigning. But you're right in doing it. Let me thank all of you for very interesting questions, for your attention, and please let's give the panel a hand.